Today I'm going to talk to you about a common problem that we've been treating here in Amrita since 2009. It's herbs policy. This is a patient and patient family education video in case you have questions that you didn't get to ask during the encounter or questions that can come up as we provide care for you. What is herbs policy? It is injury to the nerves of the arm around the time of delivery. And why this happens, it's hard to say. It can happen in utero while the baby's in the womb. It can happen when the baby comes out. It can even happen afterwards. What we do know is the nerves are injured, and now we have to get them to function so the baby can grow normally. Who normally treats this? More often than not, OBG will diagnose this problem. Usually they send directly to us because we are the hub around which care happens. But occasionally they'll go to pediatric neurology, get a nerve conduction study, and once the diagnosis is made, the patient gets sent to us again. The next people that get involved often are plastic surgeons, where you don't find physiatrists. Most people are anxious, do we need a surgery or not? So if it's not a surgery case, it's fairly straightforward, and a plastic surgeon who's knowledgeable will send to us physiatry. If not, they might send the patient to a physiotherapist. The thing is with physiotherapy is at some point it's not going to work. Not every child is going to get complete recovery from physical therapy. So we do find physical therapists who refer patients to us also. What usually happens and why you should know this? From 0 to 3 months, the affected muscles start to act in about 60% of our patients. From 4 to 7 months, we often find complications begin to emerge. And from 8 to 12 months, we find about 40% of our patients have a complete recovery, 30% stagnant, 30% get worse. The full recovery patients are those whose nerves have not been damaged that badly and the families who do proper rehab. Stagnation is often where the nerves are not injured badly, but the family may not be doing the proper rehab or not coming for a follow-up. And those who get worse are often where the baby has a complication, but it's being ignored because the family keeps on doing therapy rather than getting a professional opinion from us. What should you do? At 1 month, you should have a nerve conduction study. You can't really do it earlier because the nerve damage has to emerge in the test. Once it's done, we can see how bad it is, and we can see it also, does it match the clinical exam? These tests are not perfect. You should be doing an hourly exercise program when baby is awake, and the more we do these kind of things, the more baby becomes accommodated to the exercises. Appropriate motor re-education is something I'll keep on repeating through this talk. What we find often is families keep on stretching the limbs rather than training the limb to function. I think the most important thing is ask questions. When parents come and ask me questions, it means they're thinking, and this is the baby who's going to get a better outcome than someone who blindly believes whatever we tell them. Things you should not do. You should not do only one session of therapy per day. If you do 1 hour of therapy and nothing more, baby's arm will get sore, they won't be cooperative, and the brain won't perceive the benefits of what you're doing. If you do a little bit every hour, maybe 5 to 10 repetitions every hour, it becomes something routine. It's not so painful, and the brain gets repeated feedback. Please don't skip follow-up meetings. How do we know if things are improving? Most babies will show movement in the arm as nerve recovers, and that's a good sign. Parents get excited when they see that, but what we want are specific movements. So if you look at herbs policy, there are children who can't move their arm overhead from the side. They can't rotate their arm outward with the elbow bent. They can't bend the elbow, they can't turn the palm up. So these are all things that we want. And if we see these movements happening, then we know for sure that kid is improving. The most common problems we find are co-activation, motor retraining problems, and treating the muscle, not the brain that controls it. So co-activation is a problem we find somewhere from 4 to 7 months. We still don't have any great physical therapy options for this. So what we do is we keep on training the baby to do function so they can make that muscle activate better. But when it doesn't work, often we have to use kinesio tape or maybe Botox to get these things to improve. The next thing is motor retraining. Once the limb is relatively loose and not having any tightness in it, and the child can move the arm, we have to start training that hand to function the way the other one does. If not, we find babies who just won't use a perfectly normal hand, or the hand starts taking up deformed positions when they try to use it because they've never used it properly. And all this comes down to treating the muscle, not the brain that controls it. What happens is people get on with endless amounts of electric stimulation, stretching, this and that. That's all good for the muscle, but it's not good for the brain that controls it. To train the brain, you have to actually do functions. So these are all the different things that we look at doing for these children as we rehabilitate them. One of the most common questions families ask me is, when should we do surgery? At 6 months, if there's complete nerve destruction, there's no recovery at all, surgery is a very good option. From 2 to 5 years, if we can do a mod quad surgery, and that's when we refer to plastic surgery for this. Again, at age greater than 10, we can look at free functioning muscle transfers. Once all these are done, rehabilitation resumes. Resume meaning this was happening already before. Before you get a surgical opinion, please do meet us. There are cases who may not need it, and we can often help them with just rehabilitation. But regardless, a surgeon is not going to be the hub of your care. They're going to be someone you maybe come to and go back from. You have to eventually have someone who's going to oversee the entire care, therapy, medical complications, and restoration of function. And that is what we do as physiatrists. Most families ask me, when can we stop rehab? If you're happy with the outcomes, stop. If you're not happy, do come back and meet us again. We have had children who immediately show very good recovery. And later on, small complications start to emerge. So they come back and we address those. Some children improve to a point, but then they stop progressing. So if you're happy with the outcomes you have, that's enough. The most common mistakes I see are going to be families going to a therapist who doesn't have experience dealing with this. It's not just that you know how to stretch an arm, it's more about training function. The next thing is wrong therapy for the time frame. Electric stimulation in brachial plexus injuries has been shown to not really be effective. From our past decade plus of experience, we also find the same thing. It makes families happy to see the baby's muscle getting electrocuted, but it doesn't actually yield a function because the stimulation stimulates the muscle. It doesn't make the brain get control over the limb. The biggest problem we find is fragmented care. Diagnosis made in one place, nerve conduction study done somewhere else, and surgery in another place. So finally, no one's communicating with each other. No one really knows what's happened or why. And who suffers finally? The baby. If you have any questions, please contact me at this email address.